Hello and welcome to HIM250. This is a capstone course that is designed to help you prepare for the national certification for inpatient coding so you can have the leg up and the advantage if you want to go work in a hospital or other acute care facility or residential facility. So this is really a big old review of everything that you have done previously. And as you know, if you don't use it, you lose it. So you're going to find, and some of you already found on week one, that maybe you don't remember so much. Okay? So I just wanted to give you an overview of the course, and let's pay attention to the things that are really going to be on this exam. I know it's called the Certified Inpatient Coder exam, but as you can see here, from the list of the subjects, the topics that will be covered in this exam, it is much more than inpatient coding, which you just finished ICD-10 PCS, and you know that's kind of that focus. But there's more to it than that, okay? There's the documentation that you have to become familiar with because that's what you're interpreting in order to determine the correct code. Of course, medical terminology, anatomy, and pathophysiology. Yes, that's why we made you take these courses. And we know that if you're not keeping up on it, you're going to forget some stuff. So there's that review in here as well. Now, of course, inpatient coding, is primarily ICD-10-CM for diagnosis coding and ICD-10 PCS for procedure coding. And that's very important for you to remember so you can keep fresh in your abilities to use those two code sets. Then, of course, we have the whole aspect of reimbursement. The IPPS, the Inpatient Prospective Payment System used by CMS, the Centers for Medicare and Medicaid Services. And then don't forget that hospitals, virtually all hospitals have outpatient departments. Same-day surgery, the emergency room, okay? Those are reported as outpatient. So we're gonna brush you up on that as well, and maybe a little CPT thrown in there because outpatient, remember, is CPT for procedure codes. Regulatory and payer requirements. Yes, that's the whole reimbursement thing. But remember, we are not in silos. We're not just coding. That's all we do. Nuh-uh. Because the purpose of the coding is for reimbursement as well as for reporting for research, public health, and things like that. So we have to remember that our jobs break outside of these code sets. Okay? And then, of course, compliance, because CCTC does not have a bail bonds fund. So we got to keep you out of jail and prison, okay? You learned about healthcare law and ethics. You had the class, okay? And don't forget about the False Claims Act and HIPAA and lots of other laws that we are required to monitor and ensure compliance with our facility. And then, of course, coding cases where you get to code from documentation. Oh, and we're back to the top of this list again. Okay? So I wanted to remind you, and yes, you all discovered that in quiz 1, and I wanted to remind you that it's more than just the coding manual, the codes, and don't forget the guidelines in the front of those code books, okay? All right, really important. All right, now also in this process, I want you to go to the AAPC website. It's www.aapc.com, and just look at the information. You should have your book already, but look at the information about the exam, because should be clear about what's going to be on the exam, and the sooner the better, so you can use this time that we're together, these 8 weeks or now 7 weeks, to study the right thing so you can sit for the exam and bing bang boom, you pass. Isn't that exciting? It is exciting. Okay, and it's nerve-wracking, and I understand that. I still remember how nervous I was. All right, each week in this course, you're going to have chapter readings in the CIC review book. Okay? I want you to actually read it. I know. When I was a student, I hated reading. I hated the reading. But this is important. This is not reading for reading's sake. This is not to just check off a box. This is because these chapters have information that are directly applicable to the questions that will be on the certification exam. And you know what else? They're also going to be on the little quiz that you're going to take in this course so that you can pass and get your certificate. Okay? So what? It's good knowledge. It's knowledge that you're going to need for on the job after graduation. And you're definitely going to need to know it to help you pass the CIC National Certification Exam. Okay? So in this course in particular, you got 3 books you got to have. You got to have this book that you see a picture of, the 2023 CIC Certified Inpatient Coder Certification Preparation Official Study Guide. Okay? And why wouldn't you have this? Because it's going to make passing the exam that much easier. Okay? And it's your textbook for this course. In addition, you need, as we talked about before, your ICD-10 PCS coding manual, and you need your ICD-10 CM coding manual. Your code, the books that have all the codes in them. And you know what else they have in them? They have the guidelines to help you do it correctly so you don't memorize. We don't memorize. Just remember, put a little tab so you remember what's where. There's also information in the coding manuals to help you with the medical terminology and the physiology and all of that stuff. It's right there at your fingertips. Okay? You just have to be smart and use your resources. Okay, so then each week you're going to take a graded chapter quiz. Y'all did this for chapter 1. Very good. Very good. I know that some of those grades were not I can't wait to tell everybody. But that's okay. It's just week 1. So use this to set the stage for doing better in all of the following quizzes. And remember, these quizzes are not so much about having you pass this course so you can get your certificate for the program. They're also practice questions for you to prepare to sit for the National Certification Exam, because that's going to be a piece of beautiful addition on your resume. It will help you get hired sooner. It will help you get hired at a higher rate of pay. Who doesn't want that? Okay. Now, as you are going through the chapter and as you are going through the quiz, okay, if there's a question, if you're not sure, why is it that, why, then email me and we can discuss it. Okay? I'm here 7 days a week. I'm in this course. Okay, then once you take that quiz, you're going to do a chapter quiz review. You're going to go back over that quiz and you're going to look carefully at the questions you got wrong. And you're going to look at the correct answer, and then you're going to figure out why you got the answer wrong. Where did you go wrong, and how can you correct your thinking, your process, okay? Now, I'm going to tell you right now, So this is an easy grade. This is easy. Except some of you might notice that you did not get 100% on this review assignment. Why? Because all you did was say, oh, I got this wrong. This is the correct answer. I don't need you to tell me what the correct answer is. I know what the correct answer is, and you now know what the correct answer is. I want you to do your critical thinking and figure out, where did you misread? What did you forget? What did you not remember? Where did you find the correct answer? Okay? So that you can fix your brain, so that when you're taking the national certification exam, your brain goes, oh, wait, I remember what the correct answer for this is. Okay. All right. Each week in the course, in the contents of the course, we threw in some extra stuff. It might be a handout, it might be a link, something that's going to help you connect to the industry in real time. This is going to be very helpful to you when you are sitting in an interview. Okay? Whether it's face-to-face, on the phone, on Zoom, it doesn't really matter. The fact is that you got to know stuff, and this is going to help you know stuff beyond. Okay? Also very, 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 very important. Okay? This is my email address. The one that's in the system may be wrong. And in that case, if you're emailing me, your emails are going to the fourth ring of Saturn. I will never, ever see them. So take a moment and make sure you write this down, so that when you email me, I will respond within 24 hours. And I can email you and answer your questions right there, which is really good. I like to do that because then you can print out my answer and use that to help you study, okay? Or we could set up an appointment to talk on the phone, or we could do a Zoom or a FaceTime, whatever is best for you. I am here to support you. Don't struggle alone. Don't be quiet. Ask questions to help you understand. And then that way, when you're sitting in the exam or when you're sitting on the job, you just have to think, use what's in your head. Use the knowledge that's in your head and figure it out. That's all we want for you. Okay? Okay.